My name is Sarah O'Neill, and this presentation discusses the disparity that exists regarding access to mental health care services in rural and urban settings. From this identified issue, telepsychiatry and other options are discussed to advance and extend healthcare services to underserved patient populations in rural settings. There is a notable disparity in the access to and the quality of healthcare services available to populations in rural areas. Access to mental health care in rural settings is correlated with the underlying issues of reduced geographic access to providers, limited availability of trained mental health providers and care coordination efforts, and underutilization of available services. As discussed, there's a notable difference in access to care. An urban area is defined as an area with a population of at least 5,000 individuals or 2,000 residential housing units, with any other area not meeting this criteria being considered rural. Rural areas are described as being more open, widespread, and have a low population density. Over 60% of rural Americans live in designated mental health provider shortage areas, and approximately as many as 65% of non-metropolitan counties do not have psychiatrists. In addition, individuals in rural settings often seek mental health treatment less frequently and often with providers with less specialized training. This has been attributed to both the lack of access to mental health services and rural populations having a lower perceived need for mental health treatment services. This disparity poses a risk for populations in rural areas. For example, there are more veterans in rural areas, with more than 25% of all veterans residing in rural places. It has been found that rural male veterans, particularly, have been more likely to pass away by suicide. There have been notable trends over the past 10 years with increased pediatric emergency room visits for behavioral and mental health concerns, with significantly lower mental health follow-up care after emergency room visits noted for pediatric populations in rural areas. Ethically, advanced practice providers are challenged to service a large population of individuals while maintaining the provision of quality mental health care services, especially in rural areas with limited providers per a large geographic area. This demand can lead to feelings of burnout, which may further discourage providers to provide quality care and continued access to large populations. Systems that increase provider availability to patients are critical in expanding access to mental health care services. Telepsychiatry and the use of other telehealth technology poses a possible solution to advanced practice providers expansion of practice. Telepsychiatry refers to the use of technology to provide mental health care via psychiatric evaluations, therapy, individual, group, or family, medication management, and patient education. Telehealth services have demonstrated to be beneficial in reducing barriers to care, including providing specialty care to patients, eliminating transportation barriers, decreasing time off of work requirements, decreasing delays into care, increasing care coordination, and improving the continuity of care. Telepsychiatry can be utilized to enhance healthcare delivery in a variety of settings, including patient homes, private practices, clinics, hospitals, schools, prisons, nursing homes, and treatment facilities. Telepsychiatry has been beneficial in promoting continuity of care in patient populations. It has been found that there is limited follow-up outpatient in rural populations after emergency room visits when patients present with mental health concerns. However, with telepsychiatry, there is the potential to evaluate, prescribe, refer, support, and offer follow-up to patients experiencing mental health crises in the emergency room. Telepsychiatry can also be adapted for providers to use at various levels of care. Currently, the Accreditation Council for Graduate Medical Education doesn't require telepsychiatry training in psychiatric residents. Many professionals have entered telepsychiatry and have become telehealth services through self-taught methodologies. However, the Department of Defense and the Department of Veterans Affairs have both piloted online trainings that have demonstrated that the potential to incentivize providers to adopt telehealth has the potential to benefit providers in the future. Another consideration to continue to expand mental health care access to rural populations is to expand the portion of providers offering services in rural settings. Often, individuals who were raised in rural areas seek education and training elsewhere, such as urban settings, and then choose to practice in those urban settings. Incentivizing education and practice in rural areas is key to maintaining access to mental health care in rural settings. A clear disparity exists between mental health care services in rural and urban settings, evidenced by reduced access to providers, limited availability of trained providers, and underutilization of available services. Systems and technologies that increase provider availability to patients, such as telemedicine, have the potential to expand the availability of providers to adequately deliver mental health care services to these patients. Further questions to consider are, regardless of the primary population you plan to serve as an advanced practice nurse, how do you plan to extend access to care to underserved populations through your personal practice efforts? Would you consider alternative educational licensure to extend services to rural populations? And do you foresee any barriers to challenges or the quality of care if an increased proportion of advanced practice psychiatric providers utilize telepsychiatry services to extend care to rural populations? Attached are my references. Thank you for listening to this presentation.